Officials of the WHO are criticizing the early plans being worked on in some of the richest nations in the world to create booster shots for the COVID vaccine, while the vast majority of the world's population hasn't had their full inoculation, haven't had their first shot, and probably doesn't know when that's actually going to happen. So the Director General of the WHO said that the world's grotesque vaccine disparity was driven by greed, which seems indisputable with Dr. Rashad Richey, as he called on drug makers to prioritize supplying their COVID-19 vaccines to poor countries instead of lobbying rich countries to use even more doses. And this plea comes as pharmaceutical companies are seeking authorization for third doses to be used as boosters in some Western countries, which seems to me to be not just immoral when you have COVID spreading rapidly in many parts of the world that don't have access to the vaccine, would love to take it, have willing populations, but can't get it or don't afford it. And here we're like, let's create a third dose when there's like, we're running out of people who even want to take the second one here. So I'm glad that the Director General of the WHO is pointing this out. It is a massive immoral problem. And the US and Joe Biden specifically could be doing a lot more to help.
These rich nations know that this is a contagious virus, right? It's not like you just get to protect yourself and the virus doesn't morph and evolve into something that even your vaccine won't cover. Relying on profit-driven healthcare, it's a danger to everybody. It's a danger to the globe. Obviously, famously, Dr. Jonas Salk, who created the polio vaccine, refused to patent it, refused to make it profit-driven. He was quoted as saying, "There will be no patent. Can you patent the sun?" And that's what we need to do today. We need to look at it as something that is going to help us all. We cannot pretend we're in a bubble. We already see the Delta variant, bringing cases up here in California even and around the country. So this is something we need to really take seriously. And this is where capitalism goes awry. You want to say that we're the greatest country on earth, but at what measure are you doing that? How do you measure your success? I think we need to measure it by the most unfortunate of those in our own country. So we're not having success, actually.
Yeah. I mean, we're not having a great deal of success here in the US. It's a slightly different problem. It's still capitalism, but it's a little bit less the pharmaceutical companies and a little bit more media knowing that they can make money off of convincing people to leave themselves vulnerable to a fatal virus. But yeah, internationally, it's definitely greed. You're right, and I love this quote from Dr. Michael Ryan, emergencies chief for the WHO, says, "This is people who want to have their cake and eat it, then they want some more cake, and then they want to eat that as well." Yeah, these companies.
And we know what happens to those people. We know what happens to people that want.
Yeah, they end up needing pharmaceuticals actually. And these companies have obviously, look, they made the vaccine. That's great. I'm gonna credit the scientists who made it rather than the CEOs who run companies like Moderna and Pfizer and all that. But that's good. And they deserve to make some money off of that. They were promised money, they will be given money. But now they're want more money. Like, okay, so we got that. Now we need the booster bucks as well. And they have agreed. Pfizer and Moderna have agreed to supply small amounts of their vaccine to the COVAX program, the international effort to give it to countries that don't have the means or the access right now. But the vast majority of their doses still are reserved by rich countries, including upcoming doses. Nearly 60 poor countries have stalled in their vaccination efforts, and their biggest vaccine suppliers unable to share any doses until the end of the year. And the thing is, we here in the US, like we had a little bit of media outcry and people saying, "Hey, shouldn't we do something to help?" And eventually Biden was like, "Yes, we're gonna provide some doses someday. Maybe a few at the end of this year, mostly next year." And as Viviana said, we can see the Delta variant starting to spread, starting to take more lives here in the US, certainly internationally. What is going to be left by then? And yeah, they'll need it. And I'm glad that it'll be available then. But it's really a crapshoot for people living in some of these poor countries, just hoping that they will survive long enough to eventually get the slow, reluctant aid from wealthy countries like the US and others.
Yeah, other countries are relying on masks right now because of there's no access to the vaccine. And I hate being cynical and this borderlines on conspiracy theory, but is there a chance that these pharmaceutical companies want the virus to evolve? because then they can continue to make boosters. They can continue to give you something that you need to stay safe. Something to think about.
Yes, I hope not, but they are certainly greedy, and they are gonna want another slice of cake after the one that they're trying to prep to eat right now.
Yep.
Really fast, I did wanna let you know about the current level of success in vaccination. So let's throw up the countries that have done pretty well in terms of vaccination. We can show you. There are some countries approaching 70%. They tend to be small countries. So countries like Malta, San Marino, stuff like that, Iceland, are countries with both good policy and small, generally geographically like easy to reach populations. But then you have some larger countries eventually getting down into countries both. You've got some South American countries, some Middle Eastern countries, the UK and the US show up on the list. Eventually Spain and Canada. This is where you're dropping down to less than 50% fully vaccinated. So that's good. Some of these richer countries have been relatively successful. If you scroll really far down on that chart though, you eventually get to countries where their position on the chart looks a little bit more like this. So let's bring that up. Okay, so you might say, well, John, the numbers aren't on there. How are they doing? They're nothing. They basically have no vaccination. That's what you need to know. It is effectively the same as 0% of the population having been vaccinated. There might be some limited supply that has gone generally to the incredibly wealthy and those who are politically connected. But in a number of these countries, they might as well never have had a vaccine. And those people are going to suffer, and many will get hospitalized and many will die as the variant continues to spread. And we in the US especially, but in other rich countries too, have decided, I'm okay with that. I got mine, or maybe someday they'll get it, or they should have come up with it themselves. And we will just watch it continue to take lives and continue to spread and develop other variants as well, as you've pointed out.
And they won't be affected by just COVID either. I mean, COVID will put a stress on their healthcare systems and their hospital systems, and they're going to be affected in so many other ways for their health. The children will be affected, and I think that's been a real tough thing. And the difference between the Spanish flu 100 years ago and of course polio, because children are not affected as much here with COVID. People are getting very, very callous about it.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.